quite a little bit of motivation.
But I held back thanks to Scarlett and everybody. But anyway, this is so much fun. I used to get really nervous before this, and I was a wreck. But that changed, and I wondered why. And I saw the tent going up this week. I walked outside, and it's pretty cool to watch it, all this happen. And I've just been pumped. And that's it, just pumped. But I think it's because the need is so much greater than my little nervousness. I'm excited to share. I also used to think I was a little crazy, but I just got to look at you guys. I don't have to worry. The truth is, we're all a little crazy. We're crazy enough to believe that helping those left behind is significant, and it matters, and it's responsibility of us all. True, awful, bad craziness would be seeing a huge need in our community and not doing anything about it. Recently, a patient told Liza, who works at our front desk and is awesome, came up to her and said, "This place is like the TV show Cheers. Everyone knows your name." And that's been our hope from the beginning. I know that was shared some tonight. But anyway, I want to thank you for being here. You are a big part of Grace. I say that every year, and I mean it. We know that you're with us every day through your prayers and support. Though we're on the front line, seeing patients, we believe y'all are on the front line too. And we wanted to just give you a little glimpse into Grace. So thank you again. I want to give you some updates here. Some have already been shared, and then we're going to see a video. The first is Let's Say Grace. This is the 6th year. It's really unbelievable. It was recognized last year in our community as the outstanding fundraising event for a not-for-profit. So congratulations. That was a great idea. I love the Ebola outbreak crew up here. The next, and she's going to be embarrassed, but I'm so happy to work with Sherry Brooks. She's our full-time student-run clinic. It continues to grow. They're here tonight. They already gave us a big cheer. We're or we gave them a big cheer. But we're happy to be partnered with them, and they bring 20 to 30 med students every 2 weeks to see patients here. It's really cool. They would be seeing anybody, but they wanted to see the underserved, and so that just means a lot to us, and should to our whole community. And the next is volunteers. It's the heartbeat and the energy of grace. We have 11 primary care volunteers that come every week to every other week, and one that comes every month. And we have about 20 volunteer specialists that come every month to every other month. It's added since last year is podiatry, acupuncture, psychiatric care, hematology, and infectious disease. So that's great. We are grateful. We have 3 full-time students or they're interns. They have been students, and they're taking a year off in between med school and PA school. And they're at Grace the whole entire year, and they are a lot of fun and bring a lot of energy to Grace. We've had over 10 former interns go on to med school or to PA school. And some of those are here next, we have 3 full-time volunteers that are here every day. We treat them like staff, because they are, and they're a huge part of our team. They help with referrals, medication, and with intakes. And then again, weekly volunteers. We've had weekly volunteers here working at the front desk and other places since our first week, since we've been open. And so that's awesome. Another volunteer team I want to mention, I think they have their own table tonight, is a spiritual care team. It's in place, it's growing, and it's serving a huge need. Spiritual care is about whole person care. It's about tending to the heart. Every day, every hour, a patient cries out to God. There's now more of a support system in place. For example, where does a patient go, or what do they turn to, or who helps them when they get a new cancer diagnosis, or a spouse passes away, or they're having negative thoughts and thinking about going back on drugs or alcohol, or a parent has left them and they're having questions about trust and faith, and on and on and on. Many need prayer, someone to listen, an encouraging word, or just someone to follow up with them. That's spiritual care. It fits with the vision of whole person-centered, of the whole person-centered medical home model for the low income of Orange County. We have primary care, specialty care, care coordination. We have a medication dispensary, mental health care, and now spiritual care. And so we just love, again, that whole person care for our patients. Last year we had over 8,500 patient visits. We keep track of this, but it's not our focus. As you probably heard, our focus is on relationships. Next is we continue to reach out to those who need our services, the uninsured, low income in Orange County. We are always evaluating who's being left behind. A couple more here. Thanks to our Executive Director, Stephanie Garris. Through her work, we work with Department of Health and state legislatures to change state law to allow for smoother transition of care for our patients who receive insurance. Before this law change, when our patients received health care, we had to drop them immediately that day. And now they have 30 days. We have 30 days to help find them a new doctor. Next is we've continued to strengthen our relationship with our hospital partners, Orlando Health and Florida Hospital. Without their help, we could not make it. Just several weeks ago, Adventist Health Systems brought over 30 volunteers to clean and update our building inside and out. And they also brought 1,000 Bibles with them to give to our patients. That's pretty awesome. And finally, is an update regarding the Affordable Care Act. It is our hope that all people would have insurance coverage. That's not the case in Florida and most of the United States. As you have seen tonight, about a quarter of our county is uninsured. Last year, the Affordable Care Act was just getting going. The realities or even though we try all the time to enroll patients, we have a navigator here every month, only less than 10 of our more wealthy poor patients were able to sign up. Their medical problems are so severe and they could afford the payments. Furthermore, since our state did not expand Medicaid, almost all of our patients are not able to get insurance through the Affordable Care Act. Indeed, over 60% of our patients live below the poverty line. 80% live below 133% of the federal poverty line. Just because someone is poor doesn't mean that they get Medicaid. The need is great, the gap is still there, patients keep coming, the waiting list is long. The biggest clinical need we have is providers, either doctors or nurse practitioners or physician assistants who can see patients. And now we're going to see a video, and that'll be right to help people like her. And Wanda's in the house. Wanda, come on up here. I'm going to make her stand with me. And we got everything right here, I'm going to say. Hide this part. Something special happened 2 days ago. What was it?
God, I turned 65.
It's their birthday. Say happy birthday, Wanda. Happy birthday! And so, I've got something for you, but I'm going to give it to you in a second. But we're glad for Wanda because she had a birthday. But now she has insurance coverage. She has Medicare. But we're also sad, because she'll no longer be a patient. And we're going to miss getting to spend the time with Wanda, but you're always welcome anytime, you know that. But we also get to know another person will get to become a patient now. I want you all to know that Wanda was the first patient to ask to call and thank donors. Some of you have been called by Wanda and talked to her, and some of you, she even prayed with you guys. That was Wanda who you talked to. Wanda's been a patient actually since July 2010, not June 2011. So, July 2010, that was 2 months after we opened. And since then, she's had 50 visits to Grace. And again, there's people here tonight that helped provide care for Wanda. Over the past year, she's come to Grace 24 times with 11 specialist visits. She's had 5 lab draws. She's had 2 imaging studies. She's had 1 referral outside of Grace and is on 8 medications. All of you, everyone here has helped provide for that. Some of the themes of her video, some of the themes in her video sum up why we're here. You heard, I needed a place to go to see a doctor. Not a number, a place that cares. Grace is about whole person care. Love, compassion, hope, dignity, trust, embracing relationships. It's the essence of our faith. Just as God welcomes all of us with all of our issues and problems, and as we are, we try to extend the same to our patients. Wanda's story mirrors the majority of our patients. It goes to the heart of who we are and what we're trying to do. 6 years ago at the first Let's Say Grace, we weren't open. We were just trying to open our doors. Now we want to stay open to help keep welcoming patients like Wanda. The focus now is sustainability. Grace will continue to grow as the need is never ending, and will adapt to whatever comes. We want to be here for the long haul. We made a commitment to our patients like Wanda. We want to continue to lock arms and walk with them and listen. We cannot get bored. They need a place where everyone knows their name. As you have heard of the continuing need, this is a community problem that needs community participation. Thank you for being a big part of Grace. And together we can see to it that no one misses the grace of God. Thank you.